Are you suffering with a thyroid disorder? Are you frustrated and unsure what the future holds for you and wonder if your current treatment is really working? Do you have thyroid symptoms but think you may have been undiagnosed or worse yet, misdiagnosed? Have you been told that your lab tests are normal, so it must be in your head and you'll have to live with it? If so, let's talk about a natural approach that can get to the underlying reasons for your thyroid condition and how my thyroid recovery program can help you. Hi, I'm Dr. Randy Hansbrough. I have been trained to assess complex and difficult thyroid conditions. I am board certified in functional neurology with its emphasis on the brain through the world-renowned Carrick Institute under the auspices of the National Commission for Certifying Agencies. This is the international gold standard for postdoctoral certifications. I also continue to study the latest advances in functional medicine and functional endocrinology, as well as non-pharmaceutical management approaches to thyroid disorders. I have been in practice for over 30 years, and I am passionate about doing what I do and helping people get well. As a wellness doctor, I specialize in getting to the root cause of metabolic conditions, including thyroid disorders, and managing them effectively with natural approaches. So, our goals are, number one, to give a proper diagnosis, give symptom relief, but equally as important, find and manage the underlying cause. We need to detoxify the liver and body, decrease inflammation, and rebuild normal immune system function. So how do we do this? We do it with more extensive testing than you have probably had done before. We will be looking for overlooked clues so we can act on them. We need to identify and eliminate food allergies. We need to heal the gut, because 80% of your immune system is in your intestines, and most thyroid conditions have an autoimmune component to them. We also need to balance your blood sugar, eliminate toxins, increase energy production, improve your hormone production, and nourish your adrenal glands to improve your stress response. We need to balance your brain chemistry and nervous system, enhance structural function, and strengthen the body through improved fitness and flexibility. When we approach you as a whole person and address the cardiovascular system, the respiratory system, gastrointestinal system, the hormone system, the nervous system, and look to improve your overall health, your thyroid gland will be much more likely to function happily and in a balanced manner. The pituitary gland sits in the middle of your brain and controls your thyroid gland, so you must have a balanced brain in order for your thyroid gland to work properly. Now, thyroid hormone controls energy and function of every cell in your body because each cell has a receptor for the thyroid hormone. This means things like body weight, digestion, bone formation, blood sugar balance, moods, detoxification, liver and gallbladder function, hormonal balance like estrogen, testosterone, progesterone, cortisol, DHEA, and more. Therefore, when you have a thyroid condition, your whole body feels out of balance. Now, there are three types of thyroid conditions: hypothyroid, hyperthyroid Graves' disease, and Hashimoto's thyroiditis. In hypothyroidism, thyroid hormone levels are too low. From this, you will get fatigue, difficulty concentrating, weight gain, poor memory, depression, abnormal mood, constipation and poor digestion, thinning hair, dry skin, cold intolerance, and unrefreshed sleep. Many hypothyroid conditions are autoimmune related. With hyperthyroidism or Graves' disease, thyroid hormones are too high, resulting in increased pulse rate, even at rest, heart palpitations, inner trembling, emotional disturbances, insomnia, night sweats, difficulty gaining weight, and exophthalmos or bulging eyes. Hyperthyroid Graves' disease is an autoimmune condition 100% of the time. Then there's Hashimoto's thyroiditis, which involves alternating high and low hormones in a confused pattern, so therefore you can have symptoms of high or low hormones as mentioned before. Hashimoto's is the most common type of thyroid problem. Let's talk about lab testing. Have you been told that your lab tests are normal, but you still feel poorly? If so, then you may have been undiagnosed as to the underlying reason for your thyroid complaints, and you can't correct this with the artificial hormones Synthroid, levothyroxine, or Armour Thyroid, because the other systems of the body causing thyroid malfunction have not been addressed, and medications will not nourish the body back to balance. This is why the British Medical Journal states that 85% of all medical procedures are unproven, and the World Health Organization says that over 90% of all prevalent diseases are not treatable with orthodox medical procedures. This is because drugs or pharmaceuticals are not biochemically compatible with your body's chemistry, and they all cause side effects, sometimes very unpleasant ones. Nutraceuticals, on the other hand, are congruent with your body's chemistry. They are from nature, unadulterated, just like your body should be, which is the point of all of this in functional medicine. Our aim is to return your systems and your health back to a natural, balanced state. Functional medicine looks at test results differently, seeking the middle of the overall ranges of a particular measurement as much as possible, which we call the functional, optimally balanced range, where the body is more stable and dramatic variations at either end are less likely. We intend to do this through nutraceutical and other body natural friendly therapies. For example, the usual orthodox range for thyroid stimulating hormone, or TSH, is 0.5 to 5.0, while the functional range should be closer to the middle of that. Let's talk about thyroid patterns. There are 8 major thyroid patterns and 24 overall patterns. We must do our best to find out which pattern or patterns apply to you in order to manage your condition optimally. Prescribed medications will only affect 1 or 2 of these patterns, but if you have any of the others, you will not get the results you seek, even though your thyroid hormone levels appear normal. In order to be the most accurate, a wider test panel must be done above and beyond the usual, as I said before, not just TSH, T3, or T4. In other words, all other systems must be evaluated when logical and appropriate based on your history and the severity of your symptoms. We will potentially be looking at whole blood and blood serum, urinary values, salivary hormone levels unbound from proteins, and stool analysis of a wide range of potential abnormalities of the gastrointestinal system, which, as you'll recall, comprises 80% or more of your immune system, which could be a major cause of your thyroid condition. We will also conduct a functional evaluation of your brain involving the cerebellum, the lobes of the cerebral hemispheres, the cranial nerves, and the autonomic centers of your brainstem that regulate sleep, digestion, respiration, cardiovascular control, temperature control, and more. Remember, your brain controls 100% of your body's function, including direct control over your thyroid via the pituitary, which sits in the center of your brain and holds a special interest for me as a functional neurologist. Based on the results of your brain assessment, I will outline a therapeutic regimen under my supervision that strengthens the weak areas of your brain through active and passive stimulation, which retrains the weak areas and allows them to function more efficiently, like strengthening a weak muscle. Brain researchers worldwide call this neuroplasticity, and that is what we will be doing. This is what I call a whole-body functional approach to wellness. Let's talk about your intestinal system. A common condition caused by all of the processed foods we eat and other things such as overuse of antibiotics, infection, parasites, and more is called leaky gut or intestinal permeability. This unfortunate situation allows undigested food particles, chemical additives to foods, bacteria and cells lining your gut membrane to pass straight into your liver through a network of veins. This is an undesirable occurrence and will provoke an attack on the liver and its contents by the immune system, resulting in autoimmunity and the release of inflammatory cytokines that can lead to a variety of conditions such as rheumatoid arthritis, Crohn's disease, psoriasis, lupus, dementia, multiple sclerosis, thyroiditis, and other terrible diseases. Leading scientists have now coined the term gut-brain connection because the brain cannot be healthy if the gut is not healthy, and vice versa. Other things that can provoke autoimmunity include household chemicals, exposure to industrial chemicals, stress, chronic sinus infection and airborne allergies, gut parasites, and chronic yeast or fungal infections. For these reasons and more, including your thyroid gland, we must optimize the health of your GI tract, your gut. Another subject to discuss is how unnatural and processed foods affect our systems, with grains as one of the bigger culprits. Cereal grains and white flour has pulverized iron ore in it as iron fortification, but it isn't the way we are designed to absorb iron. As a result, it clogs up the liver and can cause malfunction over time, such as interfering in the formation of tyrosine. This interrupts the process between iodine and tyrosine in the formation of thyroid hormone. So someone with a thyroid condition needs to consider their grain-eating habits. It could be a problem for you. If your liver is dealing with an overload of iron from grains, and by the way, it might not show up on a blood test because the iron is trapped in the liver, that can further burden your liver even more than the autoimmunity alone. We do not want this. We have to also remember that the attack on your thyroid by your own immune system will not stop there. It will continue to affect other parts of your body over time and eventually leading to other conditions mentioned before. Let's talk about traditional orthodox medicine versus functional medicine. The standard medical approach, as you know, toward thyroid problems is to medicate to raise the thyroid hormone or to radiate the thyroid with X-ray or radioactive iodine to kill the gland and thereby lower thyroid hormone, or to surgically remove all or a part of it in order to lower hormone production. In the functional medicine approach, we look to uncover the deeper causes of thyroid malfunction, enabling us to better manage the overall body as a whole through body-friendly natural therapies and take the stress off of the thyroid. We want to work with your body's desire to heal without harsh interventions as much as possible. So what makes us unique at the Hansbrough Center is we conduct a more extensive investigation into what hormonal abnormalities and what thyroid pattern you have, what type of autoimmunity is involved and to what extent, what type of brain pattern you have since it is directly involved, what the state of your gut liver, and other organs is, what the overall state of your body is, and your body type for structural enhancement, and get a clearer and more comprehensive picture than what you have now. Now, once we do that, we can put together a program that meets your unique needs, combining body-friendly therapies that include brain stabilization and enhancement, gut repair and normalization, immune regulation improvement, hormonal balance to stabilize moods, liver and body detoxification to clean you out gently, fine-tuning ideal foods for you based on blood testing, and structural enhancement to improve strength and flexibility. When we pull all of this together as a team, your body as a whole and your thyroid will have a much better chance at a healthy life. Everything we do is designed to work within the natural processes that your body was created to function in. So you can now see that it's not just your thyroid gland, it's an interconnected web of physiological dysfunction that you likely have, and it's our job to untangle that web and allow for a state of wellness to return in your life. So if you're taking thyroid medication and you're not getting results, consider a different approach. You may be in one of the different thyroid patterns that has yet to be revealed to you. If so, there is more that can be done. Ask yourself, where do you picture yourself 1 year, 3 years, 5 years from now? Still taking the meds and feeling poorly? Albert Einstein and others have said, insanity is doing the same thing over and over again and expecting a different outcome. You can reach us at 772-287-7701, and I look forward to meeting you soon. Thank you.